Interculturalism guides and directs us to see all the possibilities in healthcare. Not promoting a prescribed outcome or direction allows healthcare providers to value and utilize the strengths of the individuals we serve, their families, and their cultural practices. In this, we all can benefit. It is an exchange of ideas that sees benefit in learning from one another. I strive to see the strengths and resiliency in my practice as a youth prevention specialist. Inherent in this approach is the value of learning what works for individuals and maximizing those opportunities to increase self-efficacy, sharing of customs and practices, and the approach that creates multiple ways to address health concerns. Evergreen Community Health Centre strives to respond to all of the community. The health centre seeks input from its clients, solicits feedback on our services, will partner with community members and agencies to better serve the population, and to respect the wisdom and practices of those within it. At the core of interculturalism is two values: respect and understanding. It starts with listening, believing in many different approaches, and trying to achieve more harmony. Interculturalism has two basic goals: learning and preventing conflict. In a healthcare setting, this approach fosters respect and understanding through the process of meeting people where they are at, questioning how they have come to develop their strengths, and a curiosity to learn from one another. Diversity is very important in interculturalism. It allows for us to exchange perspectives. If we do not have diversity, there is less chance to discover alternatives. Dominant cultural approaches which do not honor diversity have had a hard time in learning. In healthcare, we need to continue to learn, seek alternatives, and to gain perspective. Diversity and listening to others with respect fosters new perspectives, whether it be naturopathic treatments, peer-based health programming, or cultural storytelling. When we learn, we can all see more possibilities. Evergreen has had a long list of programming in the community, some of them targeted towards different populations, but many of them open to anyone. Some examples are PRISM services for the LGBT population, acquired brain injury program, older addiction services, Healthiest Babies Possibles. At the heart of these programs, providers and participants in the programming learn from another. I believe diversity is very important in our programming. In fact, we have many cultures represented in the people who work here at Evergreen, and that is very influential in recognizing the differences and celebrating the common values that we all try to share: self-efficacy, sharing resources, belonging, and having a voice in how healthcare is delivered and received.